You've probably heard of hip or knee replacements, but the newest medical advancement in joint replacement is a total ankle replacement. One of the few doctors worldwide responsible for this breakthrough surgery is here with us today, along with his son, also an ankle and foot surgeon and a team physician for UC Berkeley. Dr. Roger and Dr. Jeffrey Mann, welcome to Living Well. Now, I understand that both of you did your medical training in San Francisco. You worked together in your own practice at Oakland Bone Joint Specialist, and now you're doing these joint replacements, these ankle joint replacements. That's correct. Phenomenal to me. Now, you've done quite a few of these, right? Together, how many would you say you guys have done?
We've done about 250 of them now.
Okay, 250, that's a lot. Let's take a look at some x-rays that you guys showed us of what it actually looks like inside the foot. What are we looking at right here? Dr. Jeff, tell me, what are we seeing here?
What we're seeing here on the left side, that's a picture of somebody's ankle, and instead of having space in between the two bones, the bones are touching one another. So all of the cartilage has been lost. Now on the right side of the screen, that's what the ankle replacement looks like. So we replace the end of the tibia bone, which is the top bone, and the top of the talus bone, that's with metal. And then in between, there's some plastic, a very high density plastic, and that's what composes the ankle replacement.
And we're going to look at that. Let's take the next picture and take a look at that and see what, it's sort of a sideways view, because the thing about the ankle is it has to move it has to move all around in a circle. It's not just up and down, right?
That's correct. The ankle does primarily move up and down, but there is some rotational component as well, and that's what this ankle replacement allows us to do.
Wow, fantastic. How are people doing with these? How's the recovery?
People are doing very well with these. The advantage of an ankle replacement over some of the previous methods we had of treating ankle arthritis, such as an ankle fusion, the advantage of the ankle replacement is they're able to be up and walking usually within 1 month.
Wow.
And as far as the long term, we've had very good long-term success with this. We've been doing this for over 10 years, and we found that over 90% of the patients at 10 years are doing very well with this prosthesis.
10 surgeons around the country carried out the study. Now we're starting to expand it and teach other orthopedic surgeons how to do this procedure, so it will become much more popular around the country.
I bet, showing everybody how to do it. But you do a whole lot more at Oakland Bone and Joint Specialists than just ankle replacements. Tell us a little bit more about what else you do there.
We're orthopedic surgeons. We take care of bone and joint problems basically throughout the body, from the shoulder all the way down to the toes. And those conditions can be broken bones, they can be sports injuries to the shoulder, knees, or ankles, and they can be long-standing problems like arthritis.
Wow, I love the fantastic tag team here. One last quick question. We're running out a little bit of time, but you do minimally invasive procedures for the joints. What does that mean?
Minimally invasive surgery is arthroscopic surgery. So in specific joints, we can look inside with a small camera, and there's a lot that we can do to treat cartilage damage, ligaments problems, minimally invasive. Now, some things we can't do minimally invasive, such as the ankle replacement, and that requires a bigger incision. But all that we can, we do try to do minimally invasive. That allows the patients to get back on their feet and back to their activities much sooner.
Just as soon as possible. Well, thank you both for joining me. I mean, what an exciting development that you've done right here in the Bay Area. I really appreciate you explaining to me. And if you want to find out more yourself about Dr. Roger and Dr. Jeff Mann, what they're doing, including the amazing total ankle replacement, go to www.oaklandboneandjointspecialist.com or give their office a call at 510-451-6266. That's 510-451-6266. That's on your screen, so you can find out more about everything they absolutely do there. So thanks again, both of you, and on your fascinating work, and it looks like you're doing so much for the community. Now, thank you all for joining us here at the NBC Bay Area station. Tune in again next time for all of the local information that will help keep you living well.